3 tips for those suffering with lower back pain. In the early phases, you need to take things really steady. So we've got a couple of relieving tips. So using something like these wedges that we have in clinic, you could just use a trainer or a rolled up towel and just place under the hips. So when you come down through the waist, you're going to hit the bony bit there and they want to be underneath that. What that's going to do is just going to lift you slightly here. So you're going to come up from your normal position, and that will just change the pressure across the lower back here as the sacral bone lifts at this end and opens up between the top of the sacrum and the L5 vertebrae, and that will just open up the gap slightly and feel very relieving usually for the majority of acute lower back pain patients. My second tip is sleeping or lying. Lie with your knees bent up on your side. Obviously your head should be supported, and place a small towel between your knees, and that will just help separate the knees and take the pressure once again off the lower back here. And the third tip is sleeping on your back or lying on your back. Place a small towel under the knees, slide the legs down so make sure it's right under the knee joint, and just let the knees rest on there. By making sure you're in the optimal position when you're sleeping, you're not causing a lot of aggravation, you're much more likely to get a good night's sleep, which is really important when we're healing, as a lot of healing takes place at night when that's being prioritised over other things like digestion and brain function.